Hey there, pharmacy owners. So I am still getting tons of messages and questions from other pharmacy owners about where they can source semaglutide, tirzepatide, any of the GLP-1s, or even other sterile compounds in order to be able to sell in their pharmacy. This is such an exciting time in pharmacy, something that's actually hot, something that people are willing to pay money for, something that actually works for your patients. I mean, working with these patients and seeing them lose weight is just warm and fuzzy to the heart. So I want to go over the companies that I use and I recommend. There are certainly many more, and a lot of the companies out there are fantastic. And just talk a little bit about the differences between a 503A pharmacy and a 503B pharmacy. So if you are not a sterile compounding pharmacy, you might be thinking that you're kind of left out of the craze. There are some non-sterile formulations that you can do, but we all know that the injectable is absolutely the hottest product. It's absolutely what works the best. Even though you certainly can definitely get results from like a sublingual. I've even seen some people with the troches or the films or the nasal spray. But we're just going to be talking about those sterile compounded prescriptions. So if you're a non-sterile compounding pharmacy or you don't do compounding at all, you are thinking like, what can I do? So you've basically got two options, and the options that work for you are going to depend greatly on your state laws. If you're not sure about your state laws, you're not sure how to find out about that, one, you can call your board of pharmacy. Not all boards of pharmacy are super helpful, so that may not be helpful. Secondly, I highly recommend APC. If you are not a member or don't support APC, I highly recommend you do. The website AP, the number 4C.org. You can also find them on LinkedIn. They are fighting for pharmacies' rights, not only to compound the GLP-1s, but in lots of areas of compounding. And they have really been at the forefront of the legality of what's okay, what's not okay, especially when talking about peptides and GLP-1s. You can also talk to maybe your state association. They might know. Talk to other pharmacy owners. They might have done some work or done some research. Certainly, there's no shortage of places to go ask. Feel free to ask Google as well. However, but your two options are essentially buying from a 503A pharmacy or a 503B pharmacy. And if you're not familiar with kind of the differences between these, a 503A pharmacy is your typical independent pharmacy, not usually, small location, small town. You're just serving your local community. You compound, with mortar and pestles and maybe some equipment, things like that. You generally don't ship across state lines. You don't have massive sales teams and things like that. It's a legal designation for a 503A pharmacy. So you follow your state board of pharmacy rules. Those are the things that are most important to you as a 503A. Chances are the FDA is never going to come into your pharmacy. They're never going to see what you're doing. It's your state board of pharmacy that is king. Now with a 503B pharmacy, this is a fairly recent designation from the FDA for bigger compounding pharmacies. And the reason I say bigger is because they generally are bigger in order to be able to comply with all of the regulations to become a 503B. So 503Bs are a little bit more like manufacturers. It's still compounding, but they generally serve multiple states. They ship across multiple state lines. They're held to good manufacturing practices, not just compounding practices. And so it is very much tougher to be a 503B pharmacy. Lots of inspections. FDA is very much looking at you and every single thing that you do. Yes, your state board of pharmacy can come in, but it's the FDA that you're really worried about. Both pharmacies can sterile compound. They can both sterile compound GLP-1s or semaglutide or tirzepatide. But what they can do with those compounds is a little bit different. So 503As, generally speaking, can only dispense a compounded prescription pursuant to a prescription for a specific patient. 503Bs, on the other hand, can bulk compound. They can ship to a hospital 100 vials of something, and they have no idea what patient that's going to be used by. And so the 503B rules allows the pharmacy to make large batches of compounds and sell that as stock to another pharmacy. So you as a 503A pharmacy, which is what you are if you're not a 503B, if you don't do sterile compounding, you can either get from a 503A or a 503B. Now, the products are going to be the same. They might make different formulas or they might do different things, but your products are, they should be sterile. They should, do all the same kinds of things. There's a couple of differences you might notice in the products. If you buy a product from a 503A or they dispense through a central fill agreement or something like that, you will notice that they will have shorter beyond use dates compared to a 503B. 503B's pharmacies can have much longer beyond use dates because of the standards that they're held to. So there's many options, and a lot of people ask. So not every state allows central fill options, but the pharmacy that I recommend that you reach out to see if central fill or buying from a 503A is a good fit for you is South End Pharmacy, and we'll post all the links in the comments below to kind of help you with that. And then on the 503B side, there's two pharmacies that I recommend. The first is BPI, B as in boy, P as in Paul, I as in ice cream, BPI Labs. They have a massive operation. They can do huge number of batches. They're not running out anytime soon. It often can be the lowest cost per milligram, but it isn't always a good fit for every pharmacy. They don't ship to every single state. They have one size vial. There's not a whole lot of variation. So if you're looking for something maybe in a different state, or looking for something with variation or tirzepatide or different tirzepatide dosings, those kinds of things, then I highly recommend PQ Pharmacy. PQ Pharmacy, they've been doing compounding for many, many years, and they have a wide variety of products. So there's a lot of other products that you can get from PQ Pharmacy, which makes them a good match for some of you. So those are the ones that I recommend. Like I said, there are many, many others beyond that. 503Bs, I think all 503Bs are essentially the same in terms of quality because they are all be monitoring by the FDA, but they may not all be the same in terms of customer service. They may not be the same in terms of pricing or in what states they ship to. So it's important that you call them up and just find out. They pretty much make business by selling to other pharmacies. So they make it pretty easy to talk to them and find out. If you're wondering what the 503B pharmacies are, you can actually find the whole list on the FDA website. That's pretty easy peasy to find out. On the 503A side, for South End Pharmacy, they're not available in all states. Not every state allows interstate central filling. Some states only allow in-state central filling, so you have to be in the same state as the central fill pharmacy. So there's a lot of little different rules and regulations, and this is where chatting with maybe your association, chatting with your board of pharmacy, chatting with other pharmacy owners can help give you some insight. If you have any questions at all, feel free to just post them below in the content. Myself or my team will answer it for you as best as we can, or at least point you in the right direction. And if you like this content and it was helpful to you, I just ask that you please share it with another pharmacy owner. Maybe it'll be helpful for them, and it'll also help me know what kind of content that you like so I can make more to help you. So here's to a happy, profitable pharmacy, and please let me know if you have any questions.